Today I'll be teaching you about bipolar disorder. I'm sure there are a few of you that already know a little bit about this disorder, but to start things off, I will show you a small video that will give you a deeper understanding of what bipolar disorder is and how it affects someone.
Bipolar is a chemical imbalance in the brain, which controls your emotions. Before I suffered with my bipolar, I didn't have a clue what it was about. Never even thought about it, to be honest with you. I suppose unless you go through these things, you don't really understand them. The way it made me feel at the time, when I was first going through it, I felt incredibly low, really worthless. I was on a train to destruction, basically, just plummeting myself into the ground. My mind was just thinking, you're lower than scum. On the opposite end of the scale, within a matter of literally months, I went from really low to really, really up there in the clouds, as really feeling just the best ever. But also another kind of horrible feeling of being overrun. I felt like I was unstoppable. Like I had all these ideas in my head, these brilliant ideas that I had to share with people, and it was just too much going on in my head, and I couldn't control it. It was like my head was really, really hot. Do you know what I mean? There was just so much going on. I felt my head was going to explode. So I had that feeling, but I couldn't control it. I couldn't sit down. I couldn't sit down. I couldn't relax. My mind had just completely overrun me, and I was just on the go all the time. I don't know how I managed to do it, to be honest with you, looking back on it now, but at the time it all just seemed normal, completely normal. Now I've been through it, I can look back and look at it in a completely different view now. Calling something like that mental instantly creates that stereotype, you know. It's almost like a swear word in a way. People just associate it with being something really, really bad. I don't feel a different person. I feel like I should feel normal, like everybody should feel, and it's made me stronger.
Very often, people have misconceptions of what bipolar disorder truly is. Some people believe that bipolar disorder is not an illness, although in reality, it's a highly treatable but reoccurring genetic illness that can be controlled. Does everyone with bipolar disorder have large mood swings, going from very depressed to manic and out of control episodes? The answer is no, yet the range of mood symptoms exist. Not all people living with bipolar disorder experience these symptoms in the same way. In some cases, the person may have mainly depressive episodes with a few symptoms of mania, called hypomania. What is bipolar disorder? People who suffer from bipolar disorder experience dramatic emotional states, called mood episodes. There are two types of mood episodes, manic and depressive episodes. A manic episode is when the individuals are overly excited or joyful. As for depressive episodes, which is when the person is extremely sad or hopeless. People who suffer from bipolar disorder can be unpredictable and irritable during one of their mood episodes. When these episodes happen, there can be extreme changes in energy, activity, sleep, and behavior. Episodes can last for a long period of time, days or even weeks, and sometimes the episodes are too severe that the person cannot function normally. Mixed state is when the individual has both manic and depressive episodes. During a mixed state, the person may be agitated, have trouble sleeping, experience major changes in appetite, and even suicidal thoughts. Symptoms of manic episodes include mood changes, a long period of feeling high or overly happy or outgoing moods, extremely irritable moods, agitation, feeling jumpy or wired. Then there are behavioral changes, which consist of talking very fast, jumping from one idea to another, having racing thoughts, being easily distracted, increasing goal-directed activities such as taking on a new project, being restless, sleeping little, having unrealistic beliefs in one's abilities, and behaving impulsively. Symptoms of depressive episodes include mood changes, a long period of feeling worried or empty, loss of interest in activities once enjoyed. Then there are behavioral changes, feeling tired or slowed down, having problems concentrating, remembering, and making decisions, being restless and irritable, changing eating, sleeping, or other behaviors, and thinking of death or suicide or even attempt of suicide. There are 3 forms of bipolar disorder. Bipolar disorder is grouped into several classifications depending on the occurrence of the mood episodes. First off, there's bipolar I disorder, which is a manic-depressive state characterized by alternating manic-depressive and mixed episodes. Then there's the bipolar II disorder, which is when the individual has severe depression or hypomanic episodes. The last form of bipolar disorder is cyclothymia, which is a less severe form of bipolar disorder that is characterized by alternating episodes of both mild depression and hypomania. Is there a cause of bipolar disorder? While the cause of bipolar disorder is still unknown, there are many factors that play a role: genetics, brain chemicals, environmental factors, and even medical illnesses. Bipolar disorder is often inherited, with genetic factors accounting for approximately 80% of all bipolar disorder. If one parent is bipolar, there's a 10% chance that his or her child will have it too. Even if one family member has the illness, it is not a given that the child will have bipolar disorder as well. Bipolar disorder is related to having an abnormal level of serotonin in the brain. For those who don't know, serotonin is one of the neurotransmitters in the brain and one that strongly affects a person's mood. Bipolar disorder may be linked to a stressful life event, yet it is highly unlikely that stress is a cause of bipolar disorder. Seasonal factors can also play a role in the onset of bipolar disorder, yet again, it is not a cause. Some medications and certain illegal stimulant drugs can also cause manic and hypomanic symptoms. Is there a cure for bipolar disorder? As of right now, there are no cures. However, there are proper treatments that help most patients and allow them to gain better control on their mood swings and symptoms. There are several effective ways of managing bipolar disorder, such as pharmacology and psychological techniques and treatments. There are a variety of medications used to treat bipolar disorder, yet it is very common for patients to combine different medications. People suffering from bipolar disorder can also seek treatment by talking to a psychologist and developing an individualized program to improve the management of their episodes. Bipolar disorder is not always alone. Bipolar disorder is often accompanied with other psychiatric disorders, which can sometimes make the diagnosis process difficult. Some diagnoses that mimic or co-occur with bipolar disorder are ADHD, panic disorder, OCD, seizure disorder, Tourette syndrome, etc. What can help bipolar disorder? Maintaining a regular sleep pattern is one of the most important things a patient can do to help them feel better. All-nighters can cause episodes of mania or depression. Teens who stay up late and sleep in find that by Monday morning their biological rhythms are out of cycle, which plays a negative role in their mood episodes. Exercise fights depression and stress. Exercise will help the patient let go of anger, anxiety, and tension. Natural occurring beta endorphins that the brain releases during exercise also has a positive effect on the body. Sleep patterns and exercise are both crucial in stabilizing depression and manic symptoms. Did you know that bipolar disorder affects 2.3 Americans, which is 1.2% of the population? Did you know that 7 out of 10 people with bipolar disorder receive one misdiagnosis? Or that delayed diagnosis or misdiagnosis contribute to 50% of alcohol and drug abuse? And that an equal number of men and women both have bipolar disorder? Did you know that when people suffer from bipolar disorder, they have more heart problems than the rest of the population? Or that they also have more headaches, particularly migraines? Did you know that when bipolar disorder is misdiagnosed, women are more likely to be diagnosed with depression and men schizophrenia? Did you know that the following people were bipolar? Jim Carrey, Robert Downey Jr., Ben Stiller, Robin Williams, Tim Burton, Beethoven, Vincent van Gogh, Sting, Demi Lovato, Catherine Zeta-Jones, Russell Brand, Marilyn Monroe, Isaac Newton, and so many more? After my presentation, I hope you all have a deeper understanding of what bipolar disorder is, how it affects someone, and if and how it can be treated. Thank you for listening.